This video provides an overview of contemporary Canadian drug policies, starting in the 1960s with the Narcotics Control Act. The Narcotics Control Act, passed in 1961, marks one of the harshest drug laws in Canada's history. The NCA worked to implement the provisions of the Single Convention on Narcotic Drugs. It also rendered cannabis a Schedule I offense, punishable by 7 years of imprisonment for possession and up to life for supply and other trafficking-related offenses. During the 1960s, there was a growing effort to view and treat drug use and addiction as a public health issue, rather than a criminal one. However, the NCA continued to criminalize drug use. In 1969, a Canadian government commission began inquiring into the non-medical use of drugs, publishing 4 reports from 1970 to 1973. The Ledane Commission assessed Canada's newly repressive approach toward cannabis and concluded that a number of progressive reforms, including decriminalization, were necessary. More specifically, the Commission's findings recommended that criminal sanctions against people who use drugs be reduced, the offense of possession of cannabis be repealed, and medical treatment for individuals addicted to opioids be offered instead of criminal punishment. The Government of Canada, however, took little action in relation to the Ledane Commission's recommendations and continued to practice the same punitive and repressive approach to the policing of cannabis that the Ledane Commission argued so passionately against. In May of 1987, the Canadian federal government released the Canadian Drug Strategy, which uses the 4-pillar approach that includes prevention, harm reduction, treatment, and enforcement. However, the majority of federal funding was targeted to enforcement. Today, many researchers and policing bodies recognize that arrest and incarceration are not the appropriate routes to prevent or address drug use on an individual level. Following the federal drug strategy, Canada received its most harsh anti-drug law yet, the Controlled Drugs and Substances Act, which was passed by Parliament in 1996 and is commonly referred to as the CDSA. The CDSA serves as the implementing legislation for the 3 existing international drug conventions. The CDSA also repeals the Narcotics Control Act and controls the production, distribution, and possession of drugs that are listed on various schedules. There are various critiques of the CDSA. For example, Toronto Health describes how CDSA didn't include expert opinion from the Ledane Commission to remove harsh penalties for drug possession and legalize possession of cannabis for personal use. In 2007, the then Conservative majority under Prime Minister Stephen Harper passed its National Anti-Drug Strategy. Mandatory minimum sentencing, even for minor drug crimes, and a fear-based public education campaign for youth were part of the new National Anti-Drug Strategy. The new national strategy removed the government's commitment to harm reduction, emphasized law enforcement over treatment and prevention, and promised to introduce mandatory minimum sentencing for cannabis and other drug-related offenses under the CDSA. Many researchers criticize the government's decision to remove harm reduction as a key pillar of Canada's drug policy, as harm reduction strategies and services can lessen the social, physical, emotional, and/or spiritual consequences associated with substance use. The Safe Streets and Communities Act, also known as Bill C-10, was passed by Parliament in 2012. Canadians were told that many provisions of the Act, including the introduction of mandatory minimum sentences for a number of drug offenses, would target serious organized drug crime, rather than people struggling with drug dependence. However, the Canadian Bar Association, the Centre for Policy Alternatives, and the Assembly of First Nations have all argued that these amendments will impact a range of people found in violation of the CDSA, including people involved in the sale and/or production of illicit substances as a result of their struggle with drug dependence. Darcy Bennett and Scott Bernstein conducted a study in 2013 that concluded that several provisions of the SSCA, including mandatory minimum sentences for certain drug offenses, are unlikely to achieve their stated goals of deterrence and disruption of organized crime. Their findings also describe how tough on crime measures are costly, both economically and socially, and will have a disproportionate negative effect for people living with drug dependence, Indigenous people, and youth in or leaving the foster care system. The Canadian Drugs and Substances Strategy, or CDSS, was passed in December of 2016 and was created to replace the 2007 National Anti-Drug Strategy. The CDSS restored harm reduction as a key pillar of Canada's drug strategy to better enable the government to address the current opioid crisis and to work toward preventing the emergence of new crises. As a result, harm reduction focused policies, such as support for properly maintained supervised consumption sites and increased access to naloxone, will now be a formal part of the government's strategy. The CDSS guides the federal government's response to all substance use issues, including the move towards the legalization and strict regulation of cannabis. The Good Samaritan Drug Overdose Act became law in Canada in 2017. It provides some legal protection from certain minor drug-related charges and/or conditions for individuals who seek emergency help during an overdose. For instance, if an individual was in possession of drugs at the scene of an overdose, this act would protect them from potential charges, ultimately working to encourage these individuals to call 911 to assist those overdosing. The Cannabis Act came into force in 2018, creating a legal and regulatory framework for the provision of adult use recreational cannabis in Canada. The purpose of the Cannabis Act is to reduce the illegal trade in cannabis by displacing the illegal cannabis market. The Cannabis Act works to prevent youth from accessing cannabis and establishes serious criminal penalties for those who sell or provide cannabis to youth and use youth to commit a cannabis offense. So, you might be asking, what's going on in the world of Canadian drug policy today? Well, let's find out. Bill C-236, an act to amend the Controlled Drugs and Substances Act, was introduced by Nathaniel Erskine Smith on February 26, 2020. This bill would amend the CDSA to require peace officers to consider measures other than judicial proceedings to deal with individuals alleged to have been in possession of certain substances. It also sets out principles to be taken into account in determination of the most appropriate measures to take. Bill C-22 was tabled in the House of Commons on June 11, 2021. The bill would make several amendments to the Criminal Code and the CDSA that seek to fulfill the Government of Canada's commitment to address systemic inequities, including the overrepresentation of Indigenous peoples, Black, and marginalized Canadians in the criminal justice system. There are 3 areas of proposed reform in the bill. Number 1, the repeal of all mandatory minimum penalties of imprisonment for offenses under the CDSA. Number 2, changes to increase the availability of conditional sentences under the Criminal Code. And number 3, changes to the CDSA to promote the use of diversion for simple possession of drugs. When governing parties within Canada continue to create policy rooted in morality, as opposed to research and evidence, drug policy will only continue to be rooted in prohibitionist rhetoric and work to criminalize those using substances, rather than helping them work through their addiction. Researchers have demonstrated time and time again that prohibition doesn't work. It doesn't stop people from using drugs, it doesn't reduce drug-related crime or alleviate the harms caused by drug use and the drug crisis. Canada, as well as other nations, need to work towards implementing harm reduction approaches and policy that aims to help those using drugs, rather than criminalize them. After all, substance abuse is a health issue, not a criminal one.